Hi, my name is Mandy Karp, and today, let me share my screen really quickly. Going to be talking about homeless policies, preventing homelessness, and proactive models in doing this. So, population need and rationale. America is currently facing an epidemic of homelessness. Also, one of the things that has recently just been discovered is that there is a connection between adverse childhood experiences, or ACEs, and the increased likelihood that an individual will experience homelessness. So, when looking at homelessness, we have to consider trauma histories and approach this challenge through a trauma-informed framework. And then communities must take preventative actions coupled with compassionate responses toward the unhoused. The evidence, ACEs scores have not long been looked into or even been considered as contributing factors to homelessness, but more and more we find that they are very important and very relevant to the overall challenges people face with being unhoused. Like most social challenges, the people that are most affected by homelessness are those in vulnerable and marginalized communities, and those risking marginalization in more than one area of their intersectionality are especially at risk. Experiencing discrimination has been shown to be a risk factor for homelessness, and this has been reflected in homeless communities. African Americans, Native Americans, Latinx, and LGBTQ plus individuals present at higher percentages than they are statistically represented in larger societies. It wasn't until 2021, a year after the global pandemic, that the homeless population reached levels that had cities using words like epidemic, crisis. At the time of this presentation, cities are declaring states of emergency due to the number of unhoused individuals in cities. An overview of the scholarly literature on this issue. In 2021, the Lancet Public Health conducted the first systemic review and meta-analysis looking at ACEs among homeless populations. And while this study did not explore causation, it was able to determine that ACEs were more prevalent among homeless populations than the general population. Um, and then, of course, an important factor when considering homeless populations is their intersectionality. And this must be considered when looked at ACEs, mental health challenges, and substance misuse. One study found that when factoring in racial and gender differences, Black women were determined to be particularly vulnerable for the potential to be or become unhoused in their lifetime. Although men are more likely than women to be or become homeless, women often face unique risk once experiencing homelessness. They are more at risk for physical and sexual assault and premature death. It is also interesting to note that women are also the populations that score the highest when self-reporting trauma and abuse. So sexism, racism, discrimination, and other ways often lead to women receiving delayed housing through social programs as their choices are seen as moral failings. So in this way, this is very much a overall macro problem with inequality and some of the injustices that we see in society. Evidence-based interventions, what has been shown to work and reduce homelessness are things like community-based preventative services, such as access to mental health and addiction resources, prevention programs. And then some examples of these have been the Chicago Housing Choice Vouchers and New York City's Home Base program. And we'll talk more about those in another slide. So macro invention and planning. The stakeholders would be community members, business owners, the Department of Health and Social Services, providers, and others. Some of the political tensions would be dealing with members of the community, businesses, and politicians that don't take a trauma-informed perspective when dealing with homeless populations. I know some businesses have created what's called aggressive architecture to try to make it difficult for homeless to seek shelter near their stores. The current challenge is the amount of homeless people reaching crisis levels and the knowledge that many of them are struggling with traumatic histories and need support to be able to find and maintain housing. Positive change would definitely be preventative and seeing fewer people without houses. Preventative strategies based on trauma-informed frameworks followed up with compassionate assistance. These are the things that have been proven to prevent and reduce homelessness. So for the intervention strategy, consider adopting a home-based type model. These type models don't use broad strokes when they assist the homeless, but rather tailor the response to an individual's specific circumstances and needs. And sometimes that just looks like handing them cash and letting them have self-determination that they know what's best for that cash to be used on in their life. Make sure these services are accessible via outreach or other social service interventions, evaluate current programs' effectiveness at a community level, continue research into the most effective ways to prevent and respond to homelessness, and then community education and outreach regarding the link between adverse childhood experiences and homeless, trying to move the conversation to being one that is trauma informed. So, one of the biggest challenges to overcome will be the community response to homelessness. A lot of people don't consider that homelessness doesn't happen in a vacuum, and there are reasons people, end up without housing, including childhood trauma, mental illness, and substance challenges. Sometimes it is viewed as a choice, but that is rarely the case. And then resources would likely be allocated through grant money, private donations, and government funding. And here's my works cited page for that. And then I would just like to say that if communities could consider that homelessness is likely a result of past trauma, or at least is some way linked to it, maybe they could have more compassion for voting for or giving money to the programs that would benefit them most and help to house more people. Thank you.